Haptoglobin. You and I know this is one of our favorite subjects. We discuss it often.
On haptoglobin over the last few years. So we've gone through, here's a gene that might lead you towards development of type 2 diabetes in the TCF7. Then here's a gene that might help understand how to better regulate the disease if you do get diagnosed. Now we're looking at a gene that might have an involvement in aggravation, things that are going to come on top of the diabetes. They're going to further alter your ability to stay healthy. So haptoglobin is a protein that was discovered back in the 20s. It's an example of a duplication. So haptoglobin in every other organism except for humans has 5 exons. In this particular case, we had a hiccup or duplication in exons 4 and 5. And the thought behind this is, at one point in our past, this duplication conferred an improved ability to fight infection. So for those people who have this hiccup, this duplication, it's given them an extra bit of assistance in trying to clear and handle infections.
Particularly infections, if I understand it, probably occurred in South India 10, 12, 15,000 years ago, and it particularly helps against the kind of viruses that we're dealing with now with things such as COVID or coronavirus, but it was malaria and other infectious agents that the body wasn't prepared to deal with, so they made it more susceptible to handle those types of infections. Is that a good statement?
That's right. The idea here is that this was a selective advantage for us in times when infectious disease was a major threat. Infectious disease now, for the most part, this particular pandemic aside, infectious disease is not a major cause of illness or death for the most part, because we have treatments, we have antibiotics, we have ways of supporting people. But many years ago, when this duplication first occurred, we were caloric restricted. It was tough to find food. So, we didn't have the issues then that we have now, where we have an overabundance of nutrition, and maybe even not nutrition, but we have an overabundance of calories. So what happens here is HP1, its principal job, in addition to having some protective advantage for infectious disease, is it's intimately involved in the clearance of iron. So our red blood cells have an iron at the center of it, and that's what allows us to carry oxygen and CO2. Over a period of time, those red blood cells just naturally go through their life cycle and they die, for lack of a better term. So the iron that's at the center of that red blood cell has to be recycled. So haptoglobin's job is to attach itself to that iron, carry it to the liver, where it can then be produced into another fresh new red blood cell. What happens though is, if you look at the diagram there, HP1 essentially has kind of a barbell shape, and that barbell shape allows it to squeeze its way into tissue. It allows it to find the iron that's circulating free in the bloodstream. The HP2 and HP21, because they have all these branches on them, it doesn't allow it to move into the tissue as easily. So it has a more difficult time finding that iron. And what we've discovered is that iron has a tremendous ability to cause reactive oxygen damage. So it leads to all these free radicals. Undoubtedly seen, a lot of times we get all these cosmetics and you should do this and you should do that to avoid free radicals, right? Free radicals are a bad thing when it comes to your vasculature. Well, iron is one of the driving forces for production of free radicals. So what it can do is that iron can oxidize your LDL, your bad type of fat. And when it does that, it causes an inflammatory reaction. So the macrophages try to go and eat up that oxidized lipid. And when it does that, it starts producing all kinds of chemicals. Those chemicals further aggravate your vasculature. They cause endothelial dysfunction. They cause heart attacks in people with diabetes. They cause stroke in folks with diabetes. They make your HDL, your good lipids, they make that function worse. So it's been discovered over the last 20 years or so, since this marker has been brought back to the surface, that looking at patients who have type 2 diabetes, especially those that have an A1C above 6.5, have the highest risk for a complication from diabetes, like a heart attack or stroke. The good thing about this is, once you've determined what your phenotype is, once you've determined which bucket of haptoglobin you're in, whether you're HP11, HP21, or HP22, we know what we can do about that to help people get back to a healthy vasculature and a healthy clearance of iron. Right. And as it happens, if you're a HP22 and you have type 2 diabetes, you're 5 to 10 times more likely to have a heart attack or a stroke than someone who's in HP11. So that's a significant difference, right? And we know that folks with diabetes already have a heightened risk for heart disease. So this elevates that even higher. So it's really important to look and see if you can determine your haptoglobin genotype phenotype and then implement the therapy that you need to reduce that risk. And as it happens, the therapy is very simple and inexpensive.
Which is?
You have to implement a surrogate antioxidant. So that could be vitamin E, which is the best, or vitamin C, which works pretty well, but not quite as good as vitamin E. But it's important that you know which bucket you're in. And the reason for that is if you're 1-1 and you take vitamin E, you could in fact push yourself towards the very thing you're trying to avoid. You can cause yourself damage and result in a heart attack if you take the vitamin E when you're not.
In large doses.
In large doses, right. So, I mean, what you get from your diet, avocados, that sort of thing, healthy diet, is not going to result in a problem. But if you were to go take a handful of vitamin E and you get, 600, 800, 1,000 units, that's conferring some additional risk to you because you don't need the extra help. Your body is perfectly capable of recycling the red blood cells.
But the 2-2s, which, by the way, full disclosure, I'm a 2-2. I come from a family of 2-2. So everyone on the channel knows my Aunt Martha listens, and we love Aunt Martha. Aunt Martha, you're probably at 2-2 as well. So number one, try to avoid diabetes. 2, keep your blood sugar A1C levels below 6.5. And number 3, get a bottle of good vitamin E and take it and cook with things that are, for instance, I think palm oil is one of the favorable oils to cook with that, really gives you favorable vitamin E. So it's probably a good thing. If you don't know your answer, still cook with palm oil, eat some avocados. At those levels, it doesn't do the therapeutic solution, but it certainly helps move you along that path. And at those levels wouldn't hurt you if you're a 1-1 or a 2-1. Wouldn't hurt you at all if you're a 2-1 because they have an increased risk, as you see as well with haptoglobin. That's very interesting, Dave. Talk a little bit about these, the reason you chose the 3 to talk about the 3 is combining those gives you that full picture, correct? Those 3 genes that we're discussing.
Tells you if you're trying to be proactive about your health, so you're healthy today, but 5 years from now, who knows? If you were to do all 3 of these tests, you would know, do I have a heightened risk of developing diabetes? Yes or no, because of TCF7L2. Should I develop type 2 diabetes? Will I respond to metformin?
Right.
Meaning that my ATM is normal or my ATM is dysregulated or not functioning properly. And then further, if I do develop it and I respond to metformin, at some point in the future, you start to have oxidative damage. It's inevitable. So is that oxidative damage as a result, or at least driven in part by a change in my haptoglobin level?
Right.
And haptoglobin has other features. It's involved in other things. So it's involved in stroke. It's involved in all kinds of cancers. It's involved in celiac disease, perhaps.
Right.
Because the precursor for HP2 is a protein called zonulin. And what zonulin does is it causes ordinarily the epithelium in your gut is very tight. So the cells are right up against each other. They don't allow any material to cross over. With zonulin, those gaps open up and it allows material from your gut to go in across your gut lining and into your bloodstream.
Correct.
So that means that you could respond to wheat. You could respond to all kinds of allergens that you intake as part of your diet, but they aggravate you because they can cross from the gut and into the bloodstream. So there are a number of other reasons to look at haptoglobin phenotype, genotype, other than diabetes. But if you have a family risk, or if you think that you just want to be kind of ahead of the curve and make sure that you're proactive in every way you can, diabetes has a tremendous impact on us, right? Both personally, but then also as a society and as a medical issue. Diabetes is a big issue for us right now.
It may be the biggest and probably associated more with the deaths from COVID than any other risk factor, probably.
It has been very impactful in that, yeah. So we have seen quite a lot of people with cardiovascular and diabetes and the like have trouble responding to COVID. And part of it's because the cytokine storm that gets generated during a COVID infection. Well, as it happens, haptoglobin is turned on and turned off by inflammation. So the more inflammation you have, the more haptoglobin you try to produce. Right. If you don't produce the correct kind, in the sense that you don't have the normal, fully functional haptoglobin, you just drive more and more inflammation.
Right.
It turns out to be a biofeedback loop that never turns itself off.
Correct.
So I'd like to talk with you a minute about the webinar. People don't understand what the webinar is. It's actually a great way to get some access to healthcare that you're just not going to get any other way. You actually get the lab tests yourself at a local lab, a Quest lab near you, for the inflammation panel and the OGTT and the insulin survey. These are things, inflammation and prediabetes, that your doctor just does not know about. And here's the thing. Harvard Health and many others have said, look, sudden death is not always so sudden. The Hollywood picture that it's a bolt out of the blue is not realistic. It's more like real lightning, preceded by clouds, wind, and rain. Stop that metabolic storm before the lightning strikes. And here's where that metabolic storm comes from. It's inflammation, and it has to do usually with prediabetes. So again, we actually get labs, we go over them in the webinar, and then you can start finding out how you can prevent that heart attack others said that you couldn't even predict. We can show you how. Thanks.